Sage Veterinary Imaging, we're a group of expert radiologists, and our primary job is to get diagnostic answers in sick animals. And so that's our goal, is to help the animals, help the owners, help the referring veterinarians that are looking for those answers.
Pet owners oftentimes refer to their pets as their children. We really do have this human-type relationship with our pets. And so we also, in that vein, want to elevate what we can do for them. As owners, we want the same kind of care for our pets as we can get when we go into a hospital. We want those kind of diagnoses. And that's really the equipment that we have here is human level and allows us to give that standard of care to our pets as well.
We have diagnostic abdominal ultrasound, we do echocardiography for any heart issues, and then what we're kind of known for is our MRI, so our magnetic resonance imaging, where we get diagnostic images of the spine and joints of animals that you can't otherwise get with other modalities.
The ultrasound equipment makes my job easy to give my clients the best answers because I can see, at a level that other equipment just can't produce. And the equipment I have here is better than anything I've had in my career and really allows me to get the best answers.
So when a patient comes to our facility and we have this Philips 3T MRI machine that's going to be twice as fast, twice as strong as any other veterinary MRI in the area, we're able to obtain those images not only more quickly, but with better resolution. If I can see the lesion, especially in these small dogs, which can be very hard to see, and then I can quickly give a diagnosis on the images to the neurologist that sent me the patient. They're gonna know if they need to do surgery, if they don't need to do surgery, and that's gonna lead to quicker treatments and a better prognosis for the animal.
Ultrasound, we can see what's going on, and then with using the ultrasound, we can do an ultrasound-guided fine needle biopsy. We can actually get a sample of those cells. We do that all just with a needle. In a very short amount of time, we can get a sample of the cells, we can get a full answer for that patient, and they don't have to undergo that surgery. Really makes a difference to the owners, definitely to the patients, and the referring vets as well.
I've been working with Jamie Sage for about 6 or 7 years. We've collaborated on difficult cases, and we very quickly know how to manage the animals. And if there's any question about anything on the study, she's been highly accessible to discuss it.
In veterinary medicine, we use other modalities often to treat musculoskeletal or joint and muscle injuries in dogs. And we haven't always been successful at finding the cause and why they're lame or why they're not performing as well as they should at sport or even the working dog in the police force. With the Philips 3T MRI that we're able to provide, this machine allows us to obtain the resolution of the smaller tendons and ligaments and structures of the canine to better treat these animals in a way that we haven't been able to thus far.
I mean, you can see a difference in those images night and day. And there are tiny little structures that we're looking at in the brain, looking for lesions and stuff that you just can't see on the 1.5. So the 3T is it's just so cool. The resolution is just so much better. And then same with the ultrasound machine. The technology makes a big difference in diagnosing the patients and in giving them an answer.